All right. Well, once again, thank you so much for joining us to learn about the University of Medicine and Health Sciences, or UMHS. My name's Sean Powers. I'm Vice President for Admissions at UMHS, and I'll be part of the presentation this evening for you, along with my colleague, Sham Daria, who is Director of Enrollment Management. We have a lot of information to share with you this evening, so during the course of the presentation, as we talk about different topics and touch on different things with our panelists, who I'll introduce in just a moment, as you have questions, as questions arise, please type them into the Q&A box, and Sham and I will take care of answering them for you. And we'll cherry pick a few and throw them out to our panelists for their perspective as well. So no matter where you are in your journey, if you're just learning about UMHS, you're just starting to research the university and your options for medical school, if you've already applied to UMHS, or if you've already received a decision on your application to the program and you're getting ready to enroll this coming January, this winter, next spring in May, or even next fall, next September, a year from now, we'll be able to provide quite a lot of information that will be relevant to you and your interests this evening. So thank you once again for joining us. So with that, I'd like to introduce my colleagues who are with us this evening and will share their perspective on the university. First, I'd like to introduce Dr. Jagadish Nagappa. Dr. Nagappa is a professor and course director of physiology at UMHS. And in addition to that, he's also the director of the Accelerated Review Program, or ARP. And you'll hear quite a bit about that during the course of the presentation this evening. So good evening, Dr. Nagappa. It's great to see you. Thanks for being here.
Good evening, Sean. Yeah, I'm Dr. Jagdish Nagappa. I've been with UMHS for the last 12 years, and I've been teaching in England and the Caribbean for the last 27 years. I've taught physiology and various courses, but currently I'm teaching physiology and I'm part of the ARP program.
Excellent. Well, thanks so much, Dr. Nagappa, for giving us some of your time and giving some of your time to our audience this evening as well. So looking forward to hearing from you. And as you'll hear, of course, during the course of the presentation, you'll hear that academic support is a very big part of the student experience at UMHS. And to talk a little bit more about that in greater detail will be Dr. Donna Walker. Dr. Walker is the Director of Student Learning Services at UMHS. Good evening, Dr. Walker. Good to see you as well.
Good evening and good evening, everybody. Welcome to this call. I oversee a lot of our learning support for students. I work one-on-one with students to help them kind of learn in a way that matches the volume and pace of medical school. And I have over a decade of experience in the Caribbean medical school context.
Excellent. Well, thanks so much for being here to provide some of your perspective on the student experience at UMHS as well. Excited to hear from you. We're also excited to hear from two of our distinguished alumni because, of course, we can't talk about the student experience without talking about what happens after you complete your time as a student and move on to what it is you're going to medical school to do, and that is become a practicing physician. And to do that, we have two of our alums who are joining us this evening. First, she's not here quite yet because she's on her way home she got pulled into a surgery this afternoon, Dr. Kirthi Suganathavan, and she will introduce herself when she arrives in just a little while. She's in her surgery residency at Detroit Medical Center. Also joining us this evening, and also from Michigan, Dr. Zach Vanderveer. Dr. Vanderveer is in his third year interventional radiology program at Corewell Health West in Grand Rapids. Good to see you, Dr. Vanderveer. Thanks so much for joining us.
Absolutely. Thanks for the intro. I'm always excited to get on these webinars and talk to students. UMHS was the best decision I ever made. It was a huge jump and kind of risk take in my life, and couldn't be more blessed to end up where I did and to be in the specialty I am. So really happy to talk to you guys about this great school, and we'll hopefully chat a little bit more tonight.
Absolutely. I know our audience will benefit quite a bit from hearing about your experiences as a student and what you've been able to do with the education that you received at UMHS. And certainly without any further ado, I mean, as you've seen, this is the President's webinar for prospective students, and we do these on a regular basis, and we certainly can't do them without the President and namesake for the presentation, President Warren Ross, over 40 years, 45 plus years now in medical education, and he'll talk a little bit about his background and how he's built the school over the years and his vision for the future as well, and everything currently that's happening that he's been able to put into place at the University University of Medicine and Health Sciences. And with that, it's my pleasure to introduce President Warren Ross. Good to see you, Warren.
Hello, everybody. I'm having some technical difficulty. I'm looking like a very orange, and I got to figure out how to change that color scheme. Hold on a second. Maybe this will improve.
Oh, much better.
That looks a little bit better. Look good?
Good to see you. Absolutely.
Okay. So I'm very excited about this. This is my opportunity to kind of brag about what we've done, what we've accomplished, what our goals are, what's our dreams, what's our vision, and also talk a little bit about my experience in medical education, and talk a little bit about the history of the Ross family and what we've done, what we've accomplished. And as we go through the presentation, I'm going to be pulling different people in to talk about different aspects of the university. And the goal I have is to try to give you a very kind of well-rounded view of UMHS, and we look at every aspect of the university, from the academic program to living conditions to the clinical program, licensure, and what differentiates us between other institutions that are currently in the Caribbean, because we all know that as a prospective student, you're looking, you're investigating, you're trying to figure out what's the best institution for you. So we want you to walk away with a real good understanding of what UMHS is. What I like to usually do is kind of start off with my background, my history. I've been in academic medicine since 1978. My dad and I established one of the first offshore medical schools called Ross University. And at that time, we grew it into a school that had multiple state approvals, recognition by the U.S. Department of Education, affiliations with over 40 teaching hospitals, affiliations with thousands of, I mean, not thousands, affiliations with not only 40 teaching hospitals, with thousands of teaching hospitals for electives. And our graduates are licensed and practicing throughout the United States, and with thousands of graduates that are performing at an extremely well level. I tell you all this because I've had the experience and knowledge and know-how how to establish a medical school. And what happened was that when my dad finally turned 80, he decided it was time for him to retire. So we sold Ross University, but we kept an eye on what was going on in the Caribbean. And we found out that many of the schools were getting really very large. They were bringing in classes of 300, 400, 500 students a semester. And it was difficult to provide a quality education under those circumstances. So Dr. Ross came to me and said, we need to establish an alternative for students who are looking for a kind of small, boutique, individualized attention program. And that's exactly what we did. But this time we had the resources, we had the funding, we had the knowledge and experience in knowing exactly what we needed to do. It took me over 30 years to establish Ross University. Very quickly, we established UMHS as one of the more qualified, credible institutions in the Caribbean. We had unlimited resources to build a campus that was state of the art, comparable to what you would expect if you attended a U.S. medical school. Since the inception, we've invested over $100 million in developing what I consider one of the best medical schools in the Caribbean. But what makes us unique and different is that we purposefully have kept our schools small. We did that in order to provide you with the resources, the personalized education, the high quality faculty that can work with you directly to provide you with the resources, tutoring, and mentoring to succeed academically. And one of the things that I'm very proud of with that philosophy in mind is that we've been able to maintain one of the lowest attrition rates in the Caribbean. Something that's different from many of the other schools, that some of the larger schools are seeing attrition rates that can exceed 30, 40%. We're maintaining a 4% attrition rate just because of the size of the school. When I went undergrad, I went to a very large school with 40,000 students and 500 students in one of my classrooms. And here the typical size of a classroom could range anywhere between 30 and 75 students, and that's really is really important because you get to know your faculty. You're not a number, you're a person, and we set up an entire system and process to ensure that you're going to be successful. So it's not only just about the faculty that we recruit, but it's also about the learning specialists, the counselors that are engaged and involved in helping and assisting with you. And one of the things that I'm very proud of is that the caliber of the faculty we bring in, they're highly qualified, typical MD and their PhDs. And before we even offer a person a position, they go through a series of steps. They're vetted. They meet with our committee, faculty committee, and if they pass that muster, then they're required to come down to St. Kitts, meet with the students, give a presentation, and the students evaluate them and give us a survey response. And with their support, we'll hire or not hire, depending upon what they have to say. So the students are very much part of the university, which I think it makes us uniquely different. It's through your reviews and your surveys that help guide us in determining who's going to be teaching in the future. So that's a really positive thing. But what I also like a lot is that is the resources that our learning specialists are able to provide. We want to make sure that everybody who's accepted into the program, we feel morally that you should make it academically. And so part of that is the resources and the learning specialists. And Donna, maybe you could talk a little bit about how you guide and help and assist students from ARP into the EBS program and then continue on and that relationship, not only your relationship, but also the counselors that assist you with that and also working alongside of the faculty.
Absolutely. So I'll jump in to say the beginning of medical school, the transition into ARP or into our extended basic sciences program or medical school in general can feel very overwhelming for a lot of students. You're experiencing a volume and pace of medical education that pretty much is unmatched in comparison to undergrad or even in graduate school. So that experience can sometimes feel very daunting, and our learning specialists jump in really early in that process. We have a learning strategy course built into the ARP program. So if you're coming through the ARP, you're leaving ARP with what we believe are some of the strongest skills that you need in order to do well when you get into med or ABS. And on top of that course, we also do a lot of individualized appointments. We'll find that learning is very learner specific, so very individualized, and at the same time, it's very content specific. So the way you approach one course might not be the way you approach another course. So a lot of our work comes in this one-on-one appointment. We'll have repeating appointments with students. We'll check in regularly, and we'll help you to set goals, see if you're on track with those goals, and then change your learning approach to be a little bit more effective and efficient to help you achieve those goals. We also help students throughout EBS all the way up to EBS 5 and even sometimes in Maine, which I'm sure you'll hear about. But we do that through appointments and through workshops. So we'll host workshops based on areas we know historically students might find difficult or requires a different way of thinking. And we also are involved in the question-based reviews. We're also involved in ensuring that students have everything they need to do well. And like President Ross mentioned, we really believe that once you come here, you obviously have the potential to succeed in this program. We know when you are trying to get into medical school, the spirit can feel very competitive. It can be an entirely different experience from when you actually arrive. And one of the things at UMHS is that it's very community driven, which you'll see, and it feels not at all competitive, but very community based. So we also help students lead things like power up sessions and the mentor program, where students help other students to succeed. And that's something we oversee on our end as well. So a lot of support and a lot of different ways. We have the campus counselors who, again, specialize in the context of medical school. So they really understand the challenges that you might face, the adjustments that happen when you're away from home, and the transition period that you're going to experience. So there's a lot of support that we provide, and we collaborate with them in some of our workshops and some of our sessions. So you'll get a very cohesive support across all the different support units. I'm not going to talk too much about this because I'm sure it'll pop back up again, but I'll turn you back over to President Ross.
So oh geez, this color is killing me. Hold on. Ah, there you go. So the couple of the key things that Donna's involved with is, working with students on time management, test taking skills, communication skills. And another big issue that students face, whether you're in a U.S. medical school or Caribbean medical school, is test anxiety. And we start working with you immediately in the first semester or ARP. And there's a variety of different ways that we can improve upon that. A couple things that we've done over the last couple of years is that we now introduced weekly quizzes, and we find that the more students take quizzes that are USMLE based, the more you get over test anxiety. We also utilize shelf examinations in the basic science and the clinical science program. And if you don't know what those are, the National Board of Medical Examiners, who are the people who have developed the USMLE, have created final examinations that are utilized by both Caribbean and U.S. medical schools, and they utilize USMLE style questions. And you take those as final examinations in most of your basic science courses. And that also helps you not only understand the caliber and the quality of the examinations, but also the more you do of those, the more you overcome your test anxiety. But we're going to work with you all the way through the basic sciences up until you enter into the main program, because we know at the end of the day you have to sit for USMLE Step 1, which is there's a lot of anxiety for some students who take that examination. We want to make sure by the time you get to the 5th semester, you've overcome those anxieties and you're going to perform at the highest level possible. The other key in success, academic success, is our faculty that are in the basic science program. So not only they're highly qualified, competent, they have the experience, they have the knowledge, and one thing that's uniquely different from us compared to even U.S. medical schools, I would say probably 85% of our faculty or 80% of our faculty are full professors. If you look at the faculty at U.S. medical schools, the greater majority of the faculty are assistant professors. That means that the faculty at UMHS are not only highly qualified, but they have years of experience and knowledge in teaching medical school students. And that's what you're going to get if you come to UMHS. But the other part that's really important to me is they're dedicated to your success. They really want you to succeed, and they'll do everything they can to help you. And they have a program in place where after every block examination, you have 3 block examinations for each course. After each block examination, students that do not perform well are mandated and required to meet with their faculty members to go over the exam and to develop a plan of action to remediate and ensure that you're successful. But the other thing that I really like about UMHS and really kind of makes us unique is that we've now introduced USMLE review, not only in the basic science program, but also in the 5th semester in Maine. And so you'll have access to USMLE review material. You have access to UWorld in the EBS 5 Med 4. We have faculty that have created a special program utilizing those predominantly Phys Pharm Path, which are the ones that are most prevalent on USMLE, working with you in EBS 5 your last semester in St. Kitts, going over UWorld questions, and then in your fifth semester in Maine, which we'll talk about when we get to that. It's really exciting because I think we have probably the best review program out of any of the Caribbean schools, and I'll talk a little bit more about that. But Dr. Nagapa, maybe you could talk a little bit about the faculty, their dedication to the students, and the resources that we provide to them, and what we do to counsel them to ensure they're successful. Are you there, Dr. Nagapa? You're on mute, and we don't see your picture.
Thank you, President Ross. Yes, we have a very dedicated faculty and very qualified and also a lot of experience, not only in the Caribbean medical schools, but also in the US and other medical schools. We do have small class sizes, and we have students who can interact with the professors inside the classroom, outside the classroom. And we have office hours on a daily basis with students. We definitely have a Kaplan a review program, but we also have Kaplan resources in the basic sciences. Students can use Kaplan resources from Kaplan notes to Kaplan videos and Kaplan question bank. And also school provides various resources like Access Medicine, which has tons of question banks and questions, and also various textbooks published by McGraw-Hill publishers, starting from anatomy all the way to clinical medicine. So many resources are available online. And we also interact with students on a regular basis. We have students coming to office hours almost a daily basis. And students have a very personalized attention in the school as far as the faculty are concerned. President Ross.
Yep. So I was going to say, since you teach one of the main courses in physiology, why don't you talk a little bit about physiology and the expectations and how we prepare the students for USMLE?
Yeah, physiology is one of the a basic foundation for the medical program. And if anyone in your family knows, if any doctors who are working in your family, they know how important the physiology course as a foundation to the medical program. And here we teach physiology, basic physiology. We also integrate along with physiology, pathophysiology as well. And we do questions with every concept that we teach. We expose students to the USMLE style questions. And we also have quizzes like 2 weeks bi-weekly. And also we have quizzes every month. And we allow our students to use Kaplan Question Bank and USMLE World questions as well. And most of the USMLE preparation question banks are being used by most of our faculty. As a faculty, we have access to standardized question banks, and we use a lot of resources from question banks, and we incorporate that to our teaching, classroom teaching. And most of our students are very well prepared from a physiology point of view to understand even pathology and pharmacology. Even some of our students who are actually doing residency, they can talk about it.
I can definitely attest to that. Sorry, Dr. Nagapa, President Ross, I'm a little late. My name's Kirthi. I'm one of the third-year surgical residents at DMC Sinai Grace. Nice to see everyone here, and please feel free to put any questions you have in the chat. I'm always happy to answer questions too. But I just wanted to attest to what everyone's kind of saying about the teachers and the course subject line. One thing that I think is really unique about UMHS is that they really appreciate that studying and test taking is a skill. A lot of people enter school thinking you just need to study. If you're not getting the best grades, you're not studying right. But a lot of that is how you study and how you test take. And I think what's unique to UMHS is that they understand that. They understand it's a skill that can be developed, and they put the time to really help you gain the skills to be successful. So I just wanted to comment on that. And every day, what Dr. Nagapa has taught us, I still remember in my head, like the way he teaches it and the way the teachers at UMHS teach things. Even now, I still like can remember my acid bases only because of Dr. Nagapa. So it's the thing, they really try to teach it in a way that you're not memorizing, but you really understand it so that you can use it in your clinical practice, which is important.
One of the things, Kirthi, it would be nice to talk about is that Kirthi came back in between finishing her last rotation and starting her residency. She had some downtime, so she came back and taught an anatomy and also an ICM. And what I like about St. Kitts and UMHS is that another thing that differentiates us between many of the other Caribbean schools, especially the larger ones, is that we have a traditional anatomy lab with a 6-to-1 cadaver ratio, which is really important because many of the other schools, because they're so large, they can't have a traditional anatomy lab. They use plasticized specimens or they use computer models, but they don't allow they don't have traditional dissection. And for those people who are thinking about, going into surgery, I mean, the opportunity to dissect is unbelievable. And this is probably one of the most state-of-the-art anatomy labs in the Caribbean. This is my third lab that I've built. I've been to many anatomy labs in the United States. I've brought down some world-class anatomists, and they're all kind of blown away about the facility. But the other part that I really like about the academic program is we introduce not only clinical material throughout the basic sciences, starting in the first semester in physical diagnosis, but it culminates in the last semester in St. Kitts in Introduction to Clinical Medicine. So maybe, Kurt, that you could talk a little bit about your experiences in anatomy as well as ICM.
Sure. I definitely think that the way the courses are set up is very methodical. For example, in anatomy, first off, anatomy is obviously, I'm biased, but it's one of my favorite subjects. I truly think you can learn as much as you want in books, but being able to see anatomy is such a beautiful thing, and it's such a amazing thing that at UMHS you can actually dissect and be able to see, okay, this is the back muscle, this is the nerve that supplies it, this is the root of the artery. Or like when you're looking at head anatomy, when you dissect the carotid artery, like understanding, oh, if there's like what we learn in pathology and what we learn in different subjects, if there's narrowing to this artery, oh, okay, this part of the brain's not getting blood. It's just really a nice way to combine everything that you're learning and visualize it to make it make sense. Another thing that I really like about how the anatomy lab is set up, not just how much I appreciate anatomy, but how everything kind of uh, everything that all the subjects kind of align. So for example, in your first semester where you take anatomy, you're also taking, I think, histology, cell bio, you take anatomy, and can't remember the last subject you take, but oh yeah, it's right here. And you take IM, or Introduction to Physical Diagnosis. So what you're learning in anatomy, so say you're starting with cardiac system. In histology, you're learning about how the cells look in the heart. In cell bio, you're learning about the mechanics on how things work in the heart. And then in IM, you're learning in Introduction to Physical Diagnosis, you're learning about heart murmurs, you're learning about cardiac pathology and diseases. So it's kind of nice how cohesive everything is. So you learn one subject, but you're hitting it from different directions to really be able to synthesize the material and make it make sense, which I think is just really nice in the way everything's designed. So that's another thing I really like about the curriculum.
So we have a traditional, basic science curriculum, which prepares you for USMLE Step 1, good solid faculty, small school, um, and introducing shelf examinations throughout the basic science, utilization of UWorld in your last semester in St. Kitts, also opportunities to have Kaplan Medical question banks starting in the first semester onward, and we're in discussions with potentially adding AMBOSS also to that. Um, and while you're in the basic sciences, you also have research opportunities. And although we're not a research institution, there's a lot of opportunities both in St. Kitts and the United States to do research and be published, which really helps out with regards to your CV and when you're applying ultimately for residency programs. Um, Living in St. Kitts is absolutely amazing. I started my veterinary school back a long time ago in 1983, and I've been coming to St. Kitts ever since. I love the people. They're really friendly. The government is very supportive. The island is gorgeous. The beaches are terrific. The hiking is incredible. The food is good, and it's just a nice place to live. Zach, maybe you could talk a little bit about not only your experiences academically in St. Kitts and how it prepared you to enter into the clinical program, but what was it like living down in St. Kitts?
Um, yeah, so living there was honestly incredible. It was a great change of pace for me. I get pretty distracted by family and friends asking me to do stuff every weekend. It was nice because I was gone for 4 months to study medicine. So I lived in Frigate Bay, which is kind of a more touristy area down by, I think, the Marriott and the Royal St. Kitts, which are two of the larger hotels there. Um, I lived at Frigate Bay. At the Royal in Frigate Bay. I did that. They had a 24-hour gym. I could walk to the grocery store. Um, they have everything you could ever want at the grocery store, very similar to the US. I think the grocery store is called Rams, that was close to the hotel that I was staying at. The hotel also had 24-hour security, but it's a relatively safe island. There's certain spots on every continent that you don't want to go, and that's sort of similar here. I was able to get on a bus every morning from UMHS as they provide transportation to and from school. So I would hop on the bus at 7 a.m., get to school, and I was kind of weird and disciplined, and I didn't come home until the 11 p.m. bus. I was down there to study medicine, and that's just sort of how I went about it. Um, when it comes to just daily life, sort of having things to do, ways to sort of blow off steam and enjoy yourself on the island. There's a plethora of things to do. There used to be, probably still is, a scuba diving club. Scuba diving was pretty incredible over in St. Kitts. Um, there's always sort of beach parties going on. A lot of the local beach bars and beach restaurants always have fresh fish, fresh lobster, things like that to go do. So you could go to the ocean or the pool every day if you want, obviously while prioritizing your studies. But it was an incredible place to study, and I'm hoping to go back soon. But I can't say enough about the campus for one, but just St. Kitts as a whole, a very cool place to go to medical school.
Thank, thank you, Zach. So when students are accepted into UMHS, there's a couple different programs they're accepted into. Uh, One is they could be accepted directly into EBS, Extended Basic Science Program, which allows students to complete the program in 5 semesters versus 4, or they're accepted into the Accelerated Review Program. I've been involved in academic medicine since 1978. And one of the things that I know is that certain students who have the background and experience in taking the requisite courses um, need a little help in terms of building their foundation in order to succeed. And remember, at the end of the day, the dream and goal is to succeed academically and to accomplish your dream of becoming a doctor. And we feel that the accelerated review program gives you that foundation that you need to excel academically all the way through the basic science, perform well on USMLE Step 1 and Step 2, graduate, and ultimately go on to a residency in the United States. And I'm confident that this program has been very, very successful for our students. We know that, just so you know, that there are schools now that are accepting students directly into their programs in the Caribbean, but we feel that those attrition rates speak for themselves at these other Caribbean schools with 30, 40, 50%. And our attrition rate of 4% speaks for itself. We give you the foundation, we give you the tools, the resources to succeed academically. Dr. Nagaba, maybe you could tell a little bit about the accelerated review program, and then maybe Kirti, who was a student of ARP, could talk about her experiences there and how it helped her achieve her dream. You're on mute, Dr. Nagapa.
Sorry. Thank you, President Ross. Accelerated Review Program, it's a 14-week program. It gives you the essential foundation you will need to succeed in the basic sciences. And I feel like it's like a jump start preparing you for the pace and depth of the medical school coursework. And in my experience in the last 12 years of being part of ARP and the last 3 years that I'm the director of ARP program, I see almost in a year, we have 3 semesters, and at least 1 or 2 semesters in a year, the students come out of the ARP program, they get the highest GPA award at the end of the basic sciences, and they become very successful students. Because I feel like it's a life-changing program. It doesn't just prepare you academically, it transforms you, how you learn, how you study, how you handle challenges. It helps you overcome the hurdles of medical school by providing a much stronger basic science foundation. It builds confidence in students. Many students entering ARP wondering, am I ready for the medical school? By the end of the program, they've answered that question with a confident yes, because they have proven it to themselves, just like Kirti, who went through the ARP program, and she's one of the successful students and doing a surgery residency program. It also exposes students compared to students who are coming into the basic science program. ARP exposes students to the resources and strategies for success, from academic support services to learning tools. ARP introduces students to everything available at the university to help succeed, and also shows how to make a most of the use early on. As an ARP student, you will be exposed to nearly every single basic science discipline and meet the faculty who teach them. And you are at the comfort level to interact with them when you come to the basic sciences later on. At the same time, you will receive a tremendous amount of personalized attention, something that builds both your knowledge and your confidence before you start the full medical program. The ARP program actually consistently, as I said, produces top performing students in our university. As you come to the medical school, especially in a new country, can feel very overwhelming, and ARP gives you the time to adjust academically, socially, and also personally, and you can start the medical program very confidently. That's all from my side, President Ross.
Thank you. And Kirti, just before you come on, Donna, you're very involved and engaged in the ARP program. Maybe you just can touch on that again. What's your focus with this group? Because you remember the whole key is to build a foundation, give them the strength to perform at the highest level possible, working on all these skill sets that are really important. You know, most of these students who are coming into the program are coming in as undergraduate students, and it's very different to go from undergrad to grad, and especially medical school, and the level of work is night to day from undergraduate to medical school. So I think to build the foundation to prepare you for your next couple of years, you know, is really important. So maybe Don, just mention a few words, and then we're going to let Kirti speak for a few minutes.
Absolutely. So the first thing I will say is that I have students coming into my office almost every single day saying exactly what Dr. Nagapa just shared, the fact that it builds their confidence, it gives them the foundation. And I will say that whenever you start a new program, the first exam at any institution can feel very daunting, can feel a little bit overwhelming, except our ARP students going into med or extended basic sciences really show up performing right off the bat really well. So they perform really well when it matters because they have that foundation. And so specifically on my end, I mentioned that I teach a course on study skills and professional communications in the ARP program. And what we cover off in that program, in that course, is really helping you build your own profile as a learner. And we do that using some evidence-based strategies. We have an inventory that we have the students take, and then we specifically develop those gaps. So it's really customized. What you put in is what you get out, but you get this strong sense of what your strengths are, where your gaps are as a learner before you even get into the basic sciences. And so you go in with a lot of knowledge about yourself, which is ideally what you do in medical school, right? So in that program, I cover off things like the basics, how to be intentional and how to structure your time, but also how do you select the main idea from a lecture? How do you process this volume of information? What are your test taking strategies, right? And how do you self-test so you know if you know the material or not way before you even get to the exam? I also talk a lot and help students a lot with dissecting multiple choice questions. So the way that we approach those questions that are clinical vignette, that are all USMLE style, including your block questions and all of your exams, how do you interpret these longer questions, these clinical scenarios, and how do you start thinking critically and clinically from day one? So we cover off a lot of that in ARP so that by the time you start the program, you can hit the ground running. But yes, absolutely. I think it's a great place where you can develop these skills before you start med, because the rigor of medical school is really intense. I do think the rigor of ARP is also intense, and it really does mimic that of medical school. So it forces you to really develop all of these skills ahead of time, but you do so in a safe space where you're supported by all this great faculty, you're supported by the learning strategists, you're supported by the campus counselors. So it's a really great place to have your introduction to medical school, because when you leave that program, you leave with the skills you need to interpret questions better, to make sure you're answering the right question, make sure you're setting yourself up for success, for well-being. And I always say not just to survive medical school, but really to thrive in medical school. So it's a lot of things that we cover in that program, but it really, really, I think, sets this school apart from a lot of other schools, because we're not just sending you off into the deep end of medical school and hoping that you swim, but we're really kind of putting on the training wheels, giving you the content foundation, but also giving you the skill foundation so that all of the challenges you face in medical school and beyond, you kind of have the skills to learn from them. So I think, if you look now about how information is changing, how much more information we have access to than we have historically. I think I read a stat recently that said every 72 days or 73 days, the body of medical knowledge doubles, which means we know that you're going to continue learning in this career, and we want to make sure we give you the skills for not just how do I learn for basic sciences, not just how do I study for USMLE, but to make sure that as a career and in the career and as a professional, you have these lifelong learning skills and you know how to apply what you know to new and difficult situations. And that's kind of where we stand just economically and socially, right? There's a lot of change, there's a lot of talk of AI. And I know that the world that you will actually practice medicine in probably will look different from where you study medicine in. And that's where these skills really come into play, so that you have the skill of transferability and you really learn how to apply what you know to a wide range of different circumstances.
Wow, I think everyone really discussed ARP thoroughly. But for me, what I can say is I was out of school for 3 years before I decided to go to medical school. I finished undergrad and I didn't really know if medical school was for me right away. I wanted to work. So I worked in a few different jobs. I was mainly in the food science industry. And then finally, after a trip, I was like, I don't want to go back to work. Let's try this medical school journey. And I was so grateful for ARP just because I'd been out of school for 3 years. I haven't written a test, I haven't let alone studied. So it really just gave me a chance to relearn how to study, which once again, I do say is a skill. I relearned how to study, relearned how to test take. I reviewed subjects that I hadn't even looked at in 3 years. So it was really nice for me just to have that chance to look at this information in a safe setting before entering medical school. Not only that is you get 2 weeks, about 2 weeks in every single subject you're going to take throughout your entire basic sciences. which is really nice because not only do you get a little intro to the information, but you get to see the teaching style of each professor. You get to kind of see who they are, like start building that rapport with them, kind of see who you want your mentor to be. It just gives you a chance to see their testing style as well, which just, you get more comfortable so that when you are in the medical school and you're starting each subject each semester, you already have like a safe space to start with, which is really nice. And definitely very beneficial. So it's a great program, and it's just building you for success. And at the end of the day, it's not a race. You just want to be the best version of yourself so you can be the best version of yourself for your patients.
Thank you, Kirthi. So, Sean, can you just circulate, show some pictures of the campus? I don't know if we've seen many pictures, but as I'm talking, once again, state-of-the-art institution, traditional curriculum, really great faculty. You can see we're right on the Caribbean. It's a gorgeous campus. We have a lot of facilities there if you want to. We have a nice gym. This is an idea of ICM. We use high fidelity simulators. That one is iStan. But we also use Harvey, which is a cardiac simulator that was created at a university in Miami. We have on the top left, that's a traditional uh, auditorium. It can hold about over 200 students. The right-hand side is one of our small classrooms. The bottom left-hand side is an example of our multi-purpose lab. The bottom right is our research facility. And as you can see, we fully embraced audiovisual technology in all our classrooms and laboratories. It's very state-of-the-art because medicine is very visual. And so when you go into a classroom, you have access to all the PowerPoint presentations through the learning management system. That's cloud-based technology, so you can access it from not only on campus, but any part of the world. So our technology really drives the caliber and the quality of the education that we receive. So once again, traditional basic science program, good solid faculty. But one of the other things that I like is that we promote global health. And we want students to have an opportunity to go outside of St. Kitts, outside of what they really know and understand for a health system, and see what's going on in some of these underprivileged areas around the world. And it really is mind expanding and gives people a perspective that they never had before. Dr. Nagapa is a person who's in charge of the Global Health Institute. Can you tell us a little bit about some of your trips that you've taken and the experience that our students have had? Because anybody who's going on that trip is just a different person after they come back.
Absolutely, President Russ. Yeah, this is the Global Health Institute, and we are associated of Global Health Institute around the world. And we have so far, except for the couple of years during COVID, we have been doing for the last 9 years. And we have visited Peru, Guatemala, Costa Rica many times, and Dominican Republic, Puerto Rico. The students have an amazing experience. Just yesterday, I got another message from one of the students, and she sent a message to wish for my birthday, and she sent to remind her yesterday that how amazing the Costa Rica medical trip, mission trip was last year. And it's a life-changing experience for students to see the underprivileged communities where they don't have access to medicine, access to medical care. And we work with the local doctors and voluntary organizations, and students have a great exposure, and it is all supported by the institution. And we do select some students to go on a trip, approximately around 25 to 30 students every year. And they can use that experience when they apply for a residency program as well in the application. And overall, it's an amazing experience for the future doctors and to see how the medical systems work in different countries or developing countries.
Dr. Nagapa. So after you complete the basic science program in St. Kitts, you transition to Maine. You've already had physical diagnosis. You've already had introduction to clinical medicine. You've already built the foundation that you need in terms of working with patients and developing your clinical skills. And now we're going to fine tune them in Introduction to Clinical Medicine 2, where you're working with a large number of MDs who are mentoring and tutoring you while you're in Maine. And in addition to that, we established a review program, an integrated review program, which we consider to be probably the best that you're going to get out of all the Caribbean schools. And I was one of the first to actually adopt a review program many, many, many years ago in my former school. And we went from a 78% pass rate to a 93% pass rate in a year. So I'm very confident that these programs prepare you well to sit for USMLE Step 1. But what have we done differently? So in the past, we were predominantly a Kaplan review program. We went from a 7-week review to a 15-week program, giving students a lot more time to absorb and prepare for USMLE. And they used both didactic reviews with lecturers from US medical schools and included all the resources they have, including a very large question bank. Last semester, we moved from the Kaplan question bank to UWorld, which is the Rolls-Royce of question banks, and considered to be comparable to USMLE questions. And so that's incorporated in the review. So you still have the Kaplan didactic, but you have the UWorld questions. And we set apart 2 days a week working on UWorld questions with our faculty from St. Kitts, who are working as both content providers as well as facilitators. In addition to that, we've incorporated MBME as well as UWorld into self-assessments. And the self-assessments is given at the beginning of the course and then towards the end to see how well you have advanced in preparation to sit for their final examination. And in the past, it was a Kaplan final examination. And last semester, we moved to the Comprehensive Basic Science Examination, the CBSE, which was created by National Board of Medical Examination, which is considered to be comparable to USMLE Step 1. And it's really kind of a gatekeeping examination because we want you to be prepared. We want you to pass on the first attempt. And so if you pass that examination, we feel confident, and you should feel confident that you can sit for USMLE within the first or second window after completing the program. Zach and Kirthi, can you talk a little bit about how the ICM prepared you to enter into the clinical program, and how you felt that if you were comparable or equivalent to your U.S. counterparts when you got into the clinical program? Because at the end of the day, you've come from St. Kitts, you went through ICM, you're now at our affiliates all throughout the United States, Puerto Rico, and Canada. How did you feel you compared to your U.S. counterparts?
Yeah, so I would say Intro to Clinical Medicine 1 on the island, as well as Intro to Clinical Medicine 2 on the island, and then furthermore into our main session over in Portland, Maine, before you start clinicals. It is what separates us as Caribbean students from other Caribbean schools and from U.S. schools. There is no other U.S. school that has a sort of standardized review program that UMHS has over in Portland, Maine. I think you have a full semester, 4 months of studying for your boards, as well as having standardized patients, and sort of just tuning up your physical exam skills to then be put into clinical rotations alongside your peers from other Caribbean schools, from your own Caribbean school, from U.S. schools. I remember being on rotations with kids from Michigan State University, MD and DO school, as well as Wayne State University, Toledo, and Michigan University, Nova Southeastern over in California, Johns Hopkins, all of these other incredible medical schools, and I would say I was definitely comparable. And in most cases, I was answering questions, had the physical exam findings, had everything that sort of separated me from the pack when it came to all the other medical students, regardless of Caribbean or U.S. students. And I would absolutely attribute it to the Intro to Clinical Medicine courses, as well as our standardized prep course that we do over in Portland, Maine before clinicals. It just separates you from the pack. Your physical exam is tuned up. You know exactly what findings you're looking for, where to look for it, and sort of how that correlates with the labs and what tests you want to get next. These are all things that you're being asked by our preceptors and our clinical preceptors, as well as your standardized patients that are coming in with different illnesses for 4 months straight. So you really can tune up and be right at your top level going into clinicals, and it only separates you from the pack. And I think it also sort of speaks to the volume of our residency match rate, and how we're placing 90% of or higher, 90% or higher of students are matching into residencies from UMHS. And it might be because they're interviewing at schools where they were able to do clinicals for 4 weeks, and that's a 4 week long interview. So if you're really showing how valuable you are, and how much you know, and the skills you have, which UMHS, like I've been saying, does a great job of teaching you, it really just paves the way for your interview and potentially a residency spot. And I think it definitely separated me from the pack, and was more than comparable to other Caribbean schools and other U.S. schools.
I think when transitioning from your basic sciences to the clinical semesters, there's obviously definitely an element of imposter syndrome. You're leaving the nice little bubble of studying and actually having to go out there and showcase yourself and all the skills you've learned. So I think that's very normal, but I think UMHS definitely gave us the skills that we needed to, bypass that imposter syndrome and feel very comfortable in the clinical setting. And I think that's really because of the ICM months that we do and how early it's integrated into the curriculum, especially ICM2. This course is wild. Like, it's so good. There's so many elements to it that I think I still think about. For example, the standard patient encounters. I feel like a broken record because I keep saying everything is a skill, but honestly, even history taking is a skill. Knowing exactly what questions to ask and how to navigate a conversation to get the information you need to come up with a clinical diagnosis is a skill, and it's something that comes with practice. And at first, you just think, oh, it should be common sense, but no, it's definitely a skill that you develop. And at UMHS in the ICM2, we do these things called standard patient encounters. And it's basically they hire these actors who are real actors. They do a really good job pretending that they're sick, that you really think they're sick at some point. You enter a room, you have 20 minutes to do a full history, physical exam. You ask, you do your intro, you even like simulate washing your hands. You do everything that you normally do if you were in like the real world setting. And then, so you have this time of 20 minutes where you're proctored and you do your history, you do your physical exam, try to come up with a diagnosis. You tell the patient the diagnosis, which works on your communication skills and how to effectively communicate a diagnosis. And then you tell them your treatment plan. You have 20 minutes, you have no idea what illness they have ahead of time. So it's all based on what we've learned in your basic sciences. And then the next 10 minutes of that portion is there, like your other co-student who's in the room, there's two of you. The other co-student is watching your interaction and creating a 10-minute, like a less than 10-minute spiel and summarizing the encounter to the preceptor. And this is a skill that we truly do in our real world clinical practice. We see a patient, we get the history, and then we have to present it to our attendings. So it's really nice to practice these little things that you don't think mean much, but they really, really do. And it helps us shine in our clinical rotations. I think during the first few clinical rotations, they'll say, hey, go see this patient, come tell us what's going on. And being able to do that concisely and thoroughly, I think everyone's really impressed. And then we get to practice our physical skills during these sessions too, which is helpful. And then when we're doing it on our real patients, it's not really practice because we've already kind of gotten used to it. So everything is very tailored to help you succeed in your clinical semesters, which is nice, and I think really helps just battle that imposter syndrome and helps you feel like you can do this.
Thank you, Kirthi. So after you complete the 5th semester in Maine, you then transition into the clinical program once you pass USMLE Step 1. Clinical program, we're currently affiliated with 26 teaching hospitals throughout the United States, Canada, and Puerto Rico. We're the only Caribbean medical school that's actually affiliated with a U.S. medical school, that's Ponce School of Medicine, down in Puerto Rico, where we have 6 hospitals there, which also makes us uniquely different from most of the other Caribbean schools. I don't believe there's many other schools or any other schools that have as many affiliations as we do in Ponce, in Puerto Rico. And one of the beautiful things about Puerto Rico is because of our relationship and our strength in Puerto Rico, our students have excelled not only academically, but also in obtaining residencies. And we're going to talk a little bit about residencies, but one thing that I thought was very interesting and exciting was that our graduates from Puerto Rico are being offered residency positions outside the match. So they're not even going through the match. The residency directors are so enamored by the caliber and the quality of our students that they're actually offering them positions outside the match, which you don't see a lot throughout the United States. Anyway, the way the clinical program has been established, we have 26 teaching hospitals for core rotations. Core rotations are your junior year. It's where you're taking surgery, OBGYN, internal medicine, family medicine, pediatrics, psychiatry. And these are contractual relationships where the hospital has to teach towards your curriculum. The preceptors are our preceptors. And then and these are teaching hospitals, so that means that they have residency programs in their very specific disciplines. And we're always expanding, we're always developing. We have clinical programs in New York, Illinois, Michigan, Oklahoma, Maryland, California, Florida, Georgia, Wisconsin, Puerto Rico, in Canada. But we're continuously looking to expand. In your senior year, students can go to our affiliated hospitals, 26 teaching hospitals, or they can choose to go to any teaching hospital throughout the United States as long as they get permission from the clinical department. And the benefit of that is that they can showcase themselves. So if I'm a student and I'm interested in doing a residency at a particular hospital, I can go to that hospital, meet the residency director, have them get a view of me, showcase the quality of my qualities, and that gives you a leg up over many other students, because what happens is that residency directors get thousands of applications from unknown individuals. If you actually rotated through there and you got to meet the preceptors and the resident, that gives you a leg up over anybody else. So that's one of the reasons why 93% of our graduates obtained a residency. And I think that's an outstanding testimonial to the quality of the education, but also a testimony to the quality of the students. So that gives you a kind of perspective on cores and electives. Kirthi and Zach, I don't know if that helped you when you were applying for residencies and showcasing yourself, but maybe you could speak to that a little bit.
For me, it definitely did. I actually did a rotation at Sinai Grace, which is really nice. Not only like, do you want to showcase yourself, but also it's kind of a nice interview for you of the program. it's hard to get a taste of the culture. You obviously want ideally match in a place where you get along with all your co-residents. And I think the nice part about being able to do rotations in a place that you want to match is also getting a taste of the culture that the program has. Do you like the culture? Do you like your program director? Do you like how everyone gets along? That's something I got to experience at Sinai Grace and really made me want to go there just because I enjoyed my time there during that rotation. So that's another nice thing about being able to do these audition rotations.
Yeah, I would say it's invaluable, being able to rotate at multiple different hospitals. I was originally wanted to do orthopedic surgery, and I really was kind of a gunner for it, and I did a bunch for the program, and was showing up really early and staying really late, and ended up at the end of my orthopedic surgery rotation. I ended up not liking it near as much as I thought I would, and it sort of. I was very happy I did the rotation because I was able to sort of switch and find some different electives, and found interventional radiology and was able to go into that. But that program where I did my orthopedic surgery rotation, I did not apply orthopedic surgery, and they called me in October and were wondering where my application was. To apply because they thought I did a great job. And that was extremely humbling. I was absolutely shocked that a program called me looking for my application, but it just sort of goes to show how, if you're with some people for 4 weeks and you really show you're a team player, you know your stuff, you're there to help, you're there to learn, and you know how to act right in the operating room, and you know your medical knowledge. These places are looking for good outright doctors, and if that's what you're presenting them, you should be offered an interview. I would say 10 times out of 10 if they think you did do a good job during your rotation.
Thank you, Zach. So one of the things that's really important is for all the, sorry, I'm trying to get the orange out of here. Well, getting tough. Oh, there we go. Is how is the school credible? Does it have a good reputation? How do you know that? And one of the things that I always talk about is, accreditation, because that's really important. So one of the things that recently changed was this body called ECFMG, Educational Commission for Foreign Medical Graduation. They have now a new that you have to, in order to be certified them for USMLE and for licensure, you have to graduate from a school that is recognized by the NCFMEA, National Council for Foreign Medical Education and Accreditation. That's a body of the U.S. Department of Education, NCFMEA. And for those schools that don't have that recognition from the NCFMEA, their graduates won't qualify for licensure or for residency in the United States and can't qualify for ECFMG certification. So two things that we did. One is that initially we were accredited by the country of St. Kitts, and I will tell you that even in the last site visit about a year ago, which was pretty amazing, and I'll tell you an anecdotal story. So we had to submit a substantial amount of documentation, database, self-study, thousands of pages of documentation, site visit, meeting the basic science faculty, students, evaluating every aspect of the program. And at the end of the day, to do an exit interview. So, I've been through many of these since 1978. And so I'm there with all the deans, and we sit down, we got our pencil and paper, and we're waiting for them to tell us all the issues that they have. And the first thing they said to us at the exit interview is just put your pencils down. I said, well, why? And he goes, we find you to be a model for all Caribbean medical schools. We found no sites for your institution. We think that you're probably one of the best medical schools we've ever seen, which is a testimonial to not only the institution, the quality of the faculty, the education, the students, every aspect of the program they love. And the only thing that they said to us is, how can we help you recruit more students? Which I thought was pretty amazing. But it goes on from there because then we wanted to get further approvals. And there's a body out of Ireland called ACCM. They've adopted the LCME standards of accreditation. LCME is the Liaison Committee of Medical Education. LCME is the body that accredits U.S. medical schools. They have adopted both their standards as written and as applied. So we are constantly under review from ACCM, and they provide their annual reports to NCFME, US, through the U.S. Department of Education. And we are recognized by the accreditation is recognized by the U.S. Department of Education. Once again, last year we had a review by ACCM and we had 0 sites. We met every one of their standards. That means every standard that they have is the same standard that the LCME has, which is what is applied to U.S. medical schools. And we had 0 sites. That says a lot about the quality of the academic program and something that our school and our students and our graduates can be very proud of, and something that they can showcase when they're in residency programs because it really proves that we are a credible institution. So we have that. We have multiple state approvals. We're approved in Florida, California, Georgia, Florida, and we have applications into New York. So by getting approvals, there are, it means that that generally they open up more clinical opportunities, residency opportunities for you in those states. Most states don't have an approval process. Our graduates qualify for licensure and residencies pretty much throughout the United States. And I urge people to go to our website and take a look at the listings of the last several years of where our graduates are finding residencies. And you can find some premier institutions and some of the top residency programs in the country. So we're competing at a very high level and obtaining some really great residencies at the top best hospitals around the country. So I'm very, very proud of that. Last but not least, we try. I've been an alumni. I've run alumni organizations for many years. We started my first medical school in '78. The one thing that I've always heard from my graduates is that the cost of education is high. I have a huge debt. I got to pay that back. I'm not getting paid enough money in my residency program. Be conscious of that. You all have an alternative. You're going to be looking at multiple medical schools. Realize some schools are substantially more expensive than others. Also remember that you have to pay back at the end of the day, and that it becomes painful when you're in your residency and what you're going to be making at the end of the day. Also keep in mind that the Grad Plus loan program, which is for Title IV schools, both in the United States and Caribbean, it's impacting both U.S. medical schools and Caribbean medical schools, is going to go away next year, which is a major component of the federal student loan program. We're lucky enough to have Sallie Mae, which is a private loan program, which has been supporting us since the inception of the university. That program's not going away. So we always have a very strong partner with us, and we have the resources and funding. And I purposely, as the president, work very hard to try to keep our tuition competitive, low, and affordable, so that at the end of the day, when you finally graduate, you can afford to be able to pay back your loans and not suffer. And at that, Sean, I know that you have some things to talk about in admissions, so I'm going to pass it off to you.
Thanks, President Ross. I'm sorry I caught the tail end of what you were saying there. We've got a very, very active Q&A section. So thank you to all of you who are typing your questions into the Q&A. Sham and I, we're going to need to cool off our fingers after this one. There's quite a lot of typing. So just in the midst of doing that, so I will finish that answer that I'm in the midst of typing momentarily. So, I mean, you've heard quite a bit of information from our panelists tonight. So at this point in the presentation, typically there are 2 main questions that remain, and one of those questions is how would you pay for that education? And President Ross really just went into some of that. So the other main question, though, I'll take, and that is, so how do you get in? And so I'll talk a little bit about the admissions and the application process and what there is to expect as you go through that. We make it easy to apply. You can go right to the website at umhs.org. The application is online. You'll either fill out our own application, our direct application for admission to UMHS, or we give you the option as well if you've previously applied to a U.S. medical school or Canadian medical school through one of the major application services, which would be AMCAS, ACOMAS for the osteopathic programs, Texas Medical Dental, the TMD SAS, or the Ontario application service application, OMSAS, for our friends up in Canada. If you've utilized one of those application services to apply to those medical schools previously, you can get a PDF copy of that submission and you can send that to us. And with a few additional pieces of information that we will require from you when you submit that PDF, that will serve as your application for admission to the university. And from there, we'll start to work with you, our staff in the application services side of things of our office and admissions. We'll work with you to get all of the appropriate and necessary supporting credentials in so we can consider your application for admission. First thing that we'll be looking for once your application is complete is whether or not you've completed at least 90 undergraduate credits. And that's the equivalent of 3 undergraduate years. Some schools have a 1 credit system, and so it won't be 90 credits. And so don't worry about that. If you've completed at least 3 undergraduate years, you're eligible to apply for admission to UMHS. And most students do have a bachelor's degree. However, you should note it's not explicitly required. So 3 undergraduate years or 90 undergraduate credits. Important to understand, though, that there is a specific slate of courses within those credits that you must have completed, and those are the standard prerequisites. And pretty much any medical school that you'll be applying to will require you to have a basic knowledge in introductory biology, introductory chemistry, organic chemistry, physics, mathematics, and English as well. So it's 1 year of biology with lab, 1 year of chemistry with lab, 1 year of organic with lab, and we allow biochemistry as a substitute since not every institution offers organic chemistry too. 1 semester of physics and English coursework, writing intensive English coursework is as well as also a math, and I don't want to forget that. So typically calculus or statistics. And if you're researching medical schools, if you're looking at applying to medical schools, if you've already applied to other medical schools, you will see that as fairly common. The MCAT is required if you are a citizen or resident of the United States, or if you completed your undergraduate education in the United States. The MCAT is not required if you are a citizen or resident from somewhere else in the world who has not completed any education in the United States. That includes Canada. So Canadian citizens are not explicitly required to submit the MCAT, although if you have taken it, we will like you to submit it, and it is a consideration of our admissions committee. We'll also be looking for a resume or CV from you, and that's important. And again, if you're applying to medical school, really any other medical school is going to tell you the same thing. It's important that you have some sort of level of understanding of the career that you are applying to join. You should have some sort of experience, and traditionally years ago it would always be shadowing, and those opportunities are fewer and further between these days. So applicants to medical schools get creative, and if they can shadow, that's great. If they can scribe, that's become very popular in the past few years. If medical assisting, EMT work, there are just so many ways to get relevant experience to put on your resume when you're applying for medical school. We'll also be looking for letters of recommendation, and I should note that there's 2 ways to go about this. The first is if your undergraduate institution has a pre-med committee that you're working through, and they're preparing a committee letter for you for your med school applications. The committee letter is all that we require. However, if your school doesn't have that type of a committee, which is common also, or maybe you're a career changer who's gone back to school or hasn't gone back to school, then if you don't have a committee letter to support your application, we will require at least 2 letters of recommendation. And my best suggestion is those should be someone who knows you as a student, someone who actually taught you. And the best case scenario, what our admissions committee likes to see is someone who taught you in one of the sciences that would be relevant as a typical pre-med course. Even if it's not an actual pre-med course, If it's a foundational course, if it's something in the advanced sciences that you've taken, that would be the best case scenario, but not an absolute requirement. The essay is part of it, and so take a look at the website. We're not looking for an 8-page, single-spaced manifesto. We are looking for something though that's well structured, without grammatical or spelling errors. And so make sure you have somebody proofread that. So once everything comes in, our staff will review it. And I should note that everything happens on a rolling basis. So the sooner you apply, the sooner your application materials will be considered, and the sooner you can start moving through the process. And I say that sounds very standard, but as any of you know who have already applied in the U.S. or Canada, you apply, you send a bunch of information and all the supporting credentials, and then you wait for a very long time to find out if you'll be receiving an interview. That's not a rolling process. And so in the US, late in the spring, early in the summer, you get your applications ready, you submit everything through the course of the summer. Sometime around this time of the year, the interview season begins, and you'll hear about that after you've submitted secondary applications. Interview season will last, really into and through the winter. Early decisions will come out in before the holidays in December. Regular decisions will come out in the early part of the spring, around March 1st or so. And then if you're on a wait list, you'll be waiting even longer. So the entire process can take around really a full year to run its course, if you think about it, when the application services open up for submissions in May, and then submissions begin in early summer. So the entire process can take over a year. At UMHS, the sooner you apply for a term, the sooner we will begin working with your application, and the sooner you will be invited to interview, if you will be invited to interview. And most students are. We're trying to meet as many of our applicants as possible. Not necessarily in person. Most interviews are taking place like this, one-on-one though, via Zoom or some other type of chat. So after the interview, once you meet with one of our staff or faculty members or alumni who complete interviews for us, they submit a write-up about you as a candidate to the members of the faculty admissions committee. And I say it like that because all of the members of the committee are faculty, and that's who makes the decisions on, there is one student representative, and that's who makes the decisions on your application for admission. I'm the vice president for admissions. I don't make a single admissions decision, and I think that's important for you to understand. Faculty members who will be teaching you in the program will be reviewing your file and will be making the decision. So it's not an immediate decision. We do turn things around very quickly. The committee meets on a weekly basis, and so we turn things around fairly quickly. So again, whereas in the US or Canada, it's about a year-long process from making your application to making the determination on where you will enroll for medical school. UMHS, it can be as little as a few weeks. So, and that sounds jarring probably to some people who are not used to that, not expecting that. But we enroll 3 new classes per year, and I think we mentioned that earlier on. So we have the traditional, fall start date, which we just seated a couple of weeks ago. We also have a winter start date, which is in January, and we have a spring start date, which is in May. So most students who apply, about half of the students who apply during the course of the year, so not most, about half, will apply for the traditional fall start date. And then, for students who are quote unquote off cycle for some reason, or are career changers, or are at a place in their life where they're able to begin at a different time, maybe the winter makes sense for them, or maybe the spring makes sense for them. So there are a few different options. And so right now, if you have everything ready, if you've taken the MCAT, if you've completed all the requirements, and you just have not been given an opportunity to attend med school, and you are just ready to go, you could be in med school if you're accepted to UMHS as soon as this January. So something to think about for sure. And because of the way the process works again at UMHS, with everything happening on a rolling basis, let's say you're so excited about what you heard tonight, and you start your application, and your application arrives within the next few days. All of your supporting credentials come in electronically to us, and we're able to complete your application, by the end of this week or the beginning of next week. You could be interviewing mid to late next week. And then that, your file will go to the members of the faculty committee, and you could potentially have a decision a week after that. So over the course of the next couple of weeks, if you're really ready to go, we can turn things around very quickly. And it's not about, speed for speed's sake. It's a matter of we prioritize applicants as they come in instead of waiting to see everyone who is going to apply for a particular term and then deciding who we're going to accept. And obviously, that's the way it works at medical schools in the US, Canada, Puerto Rico, who have one intake per year. So that's important to understand that the members of the faculty are the ones who are making the decisions. And what decisions are those? Well, you've heard quite a bit about the accelerated review program already. And that's important. Sean, if you want to skip ahead to the next slide or two slides ahead for the decisions. Thank you. So you heard about the accelerated review program, and if you didn't catch that earlier during all the discussion of ARP, that's a decision of the admissions committee. So when you apply, when you fill out the application for admission to UMHS, you do have the ability to indicate an interest in the accelerated review program, but every applicant is considered first and foremost for direct admission to the university. And some students will be, instead of offered direct admission, if the committee feels there's additional, foundational strengthening that's necessary before they feel you will be fully prepared to succeed in semester one of the MD curriculum, they will offer you the opportunity to start in the ARP, run by Dr. Nagapa and who the program that Kurthy got her start in, as you heard about a little bit earlier. So for students who are directly accepted, it will be within one of our two curricular tracks, which you heard about. There is the standard basic science program, commonly known as the MED program, and then there is and that's 4 semesters over 16 months. And then there is what's called the extended basic science program, which is 5 semesters over 20 months. It's the same coursework. It's just either put into a standard 4-semester curriculum or spread out across 5 semesters. And many students prefer to do the extended basic science program simply because there is one less course per semester, if you think about it. Again, you're not missing anything. You're not taught any less. You still are getting all of the same coursework. It's just, are you doing it in 4 semesters or 16 months, or are you doing it in 5 semesters over 20 months? It's still less than 2 years. And before you know it, you're back in the United States. And if you're from the United States, you're in the United States, you move to Portland, Maine, and you do the 5th semester, and then you're onward to completing step 1 and moving into clinical rotations. I should note the last word that you see on the screen here is denial. And obviously some students are not going to be accepted to the university, but the way we approach that and the way the members of the admissions committee approaches it is we like to think of it as sort of a cliche, but not necessarily as a no, but more of a not yet. So we will get notes back from the members of the admissions committee about why they felt that the time is not right for you to start in the medical program. And that gives us, as the admissions team, the opportunity to relay that information to you and give you concrete steps that you can take to improve your application and reopen your application at a later date with additional information after potentially completing whatever it is specific to you that the admissions committee feels would strengthen your application. And we can give you some very specific feedback about that, again, based on the words that we get back and the feedback that we receive from our faculty. So you heard a little bit about financial aid, and President Ross talked a little bit about the cost. But Sean, let's put up the tuition and fees comparison screen. I don't think we had that up before. I know I was typing, so if you had it up before, let's take a quick look at it again. President Ross has purposely kept the tuition in a more affordable range. As you can see, the comparisons. The only way you're going to pay less money to attend medical school is if you are accepted to an allopathic program that's an in-state land grant university program, which the average is, as you can see, about $164,000. We're about $20,000 in total higher than that. And then all of your out of state public options and private options, and also the larger Caribbean medical schools are, as you can see on the screen, significantly more expensive than we are. And part of that is the structure of the university. You've heard directly from the president. There is no board. There are not shareholders who are trying to earn a living from tuition dollars and revenue, like you will see at many other institutions where private equity firms are owning them and are filling boards. That's not what's happening here. Your tuition is going back into the university, and that's important for you to understand. So all of the wonderful things that Dr. Siganathan and Dr. Vanderveer have talked about tonight are able to be done at a much lower tuition cost than, certainly schools with comparable sets of accreditations and approvals. And that's important for you to understand. So as you've heard, financial aid scholarships are certainly, available. So, as we begin to wrap up here, let's show let's show, what is it, slide 80, I think, the value slide, and some of the things that you've heard about, and just to kind of go over them. Actually, that 93% isn't 2024. That's all time. So, in our 93% residency placement rate since the inception of the university in 2008 is an incredible number. It's a testament to the dedication of President Ross and the team that started the university all those years ago. But it's even more so a testament to the dedication and the hard work and the passion of the students who have found their way to UMHS, looking for something a little bit different, looking for something on the smaller side. There are certainly other, let's say, larger and bigger name medical schools that are out there that surely you are hearing about as you're doing your research. And yet students who are looking for a smaller, more intimate, experience as a student, this is the place for them. We still have high academic standards but it's that personalized education that really sets us apart. And that's led to a 96% student retention rate. I think as you look around at other medical schools, you trust me, go look for this on certainly on any other international or Caribbean medical school that you're looking for. You will not see a published retention rate. You will not. What you will see, you will see how many people are going into residency. That's the big thing. And it gives you the impression that, this many students started and this many students went into residency. And what they don't tell you is that the schools are so large that they actually weed a number of those people out along the way. And we know that that's happening because in admissions, we find students who are, and there are a number of you on here based on the questions that we've been answering in the Q&A this evening, who are attending other medical schools and are having to leave them for one reason or another and are looking for another opportunity. And potentially UMHS could be a place for you, as we do offer advanced standing to students who have completed coursework at other medical schools, whether they be international or not. You heard Dr. Walker talking about the fantastic academic support that is provided here through dedicated faculty and the learning specialists under Dr. Walker, all happening on a state-of-the-art campus in St. Kitts in the Caribbean. You only spend a short amount of time there, though, and it goes very, very quickly. Depending on the curricular track that you're in, as I mentioned, you're only in St. Kitts for 16 or 20 months, less than 2 years, and before you know it, you are in the United States, up in Portland at our Clinical Bridge campus there, completing what's commonly known as the 5th semester program there. We have great affiliations with Kaplan and UWorld, and to support your learning. High pass rates on the important licensing exams. Again, excellent residency placements through the years, and President Ross encouraged you, and I will echo that. Go to our website, take a look at our residency placements across the years. We have the past, I think, 7 or 8 years listed there. Every residency that's been gained each of those years is up there. You could take a look at the wonderful specialties people are getting into. You could take a look at the outstanding hospitals people are getting into as well, but all done through affordable tuition and comprehensive financial aid options. So, if you think about it right now, you're on the front end. Again, whether you are just beginning to learn about UMHS or whether you've already applied, whether you've already had a decision on your application, what you're really looking to do is join the ranks of the Alumni Association, along with Dr. Suganathavan and Dr. Vanderveer, who you heard, detail their experiences in great detail. And the way you join the Alumni Association at UMHS is at graduation and during the graduation ceremony, which is held in New York City every year at up at Lincoln Center. It's a fantastic place to celebrate this momentous achievement in your life. Your family, will come in most likely and will be there with you, and you'll walk across the stage, and your name will be called for the very first time with the word doctor in front of it, and it will just be that moment that I know you are all looking ahead at right now. And perhaps we may be the person to help you get there, and perhaps a few years from now you may be in one of these photos grinning right alongside alongside President Ross. This is the best day of the year for those of us who are in the administration. I know I speak for Dr. Nagapa that that's true, and Dr. Walker, and certainly President Ross. It is the culmination of all of these years of hard work, not just the years in the MD program, but all of the years leading up to it. All of the things that you are doing right now to prepare for it. This is the end result. This is the end goal. This is the big day when you again walk across the stage and you hear your name with the word doctor in front of it for the very first time. And even saying it right now, I just get chills up and down my neck, thinking about all the wonderful ceremonies that I've been able to be part of through my career working with medical students. So once again, I invite you to take the information that you've received throughout the program this evening and to consider it. Continue to do your research. Visit us online, certainly, and start your application. And before we go, though, I want to make sure I say thank you, certainly to each of our panelists, to Dr. Walker. Thanks so much for joining us and sharing some of your insight and some of your thoughts on how your department is helping students. It was a pleasure to have you on here and to share some of that information. So do you have any parting thoughts or words of wisdom for the members of our audience?
Absolutely. I will say the biggest advantage with this university is that you have really small class sizes. You're able to interact with your professors every single day if you want to in a one-on-one context, in an office hour. You're able to have access to campus counselors who can meet with you regularly to provide you with support, and you have access to learning specialists that can also meet with you regularly to provide support. I don't know of any US medical school that has the ratio of excellent faculty support to students in the way that we do. And I'm fairly confident that no other Caribbean medical school has that ratio as well. I know at the beginning of medical school, you may not be sure what kind of support you will need, whether it's academic, non-academic, whether it's counseling support, or whether it's content support. But most people don't do well in medical school without some form of support. And we know this from decades of experience in the field. And that's why we have that kind of support available to you. So I would say strongly consider UMHS because of the kind of support, even if you're transferring in from another medical school, so we can get you going and get you on track for STEP and get you on track to practicing medicine.
So thank you so much, Dr. Walker. It was great to see you. Let me certainly say thank you to Dr. Nagapa for taking time out of your evening and sharing some of your thoughts on the faculty experience at UMHS and certainly the Accelerated Review Program, which you personally oversee. Any last thoughts from Dr. Nagapa, or did we lose him?
Thank you, Sean, for the opportunity this evening to talk to the prospective students. And this is the fourth medical school that I've been working in the last 27 years. And I definitely say very confidently that this school really prepares students well for this step on preparation for the future students. And I also hear from a lot of students who graduated from, UMHs, hundreds of them that I have witnessed in the last 12 years here. And they speak so highly about UMHs, not just because I'm working here, to be honest, I'm speaking from my heart. And this is one of the best schools that I have worked. And I have many other friends of mine working in big, small schools. And, I can say this is one of the best schools that I've really worked in.
Thanks so much, Dr. Nagapa. We really appreciate your thoughts this evening. Dr. Vanderveer, you're in the midst of an overnight shift. I know you need to get back to, so thanks so much for taking some of your time out to share your thoughts with our audience as well.
Yeah, absolutely. Like I stated before, UMHS was the best decision I ever made. They have allowed me to do things and have the opportunity to do things that I could only dream of when I was in the position of our prospective students. Sometimes it sounds too good to be true, and I feel like I was on the same webinars watching people ahead of me that were, practicing in residency now. But anywhere you go in medical school is going to give you the same amount of training. But I think that UMHS does a great job not only preparing future doctors, but also I think it just gives you a incredible culture and incredible friends and fellow peers and doctors to sort of all get to the end goal as a collective unit and they continue to do so year after year. So me and Kurthy were in the same graduating class. I would say we're best friends, and still are. We talk whenever Kurthy's available. She's in general surgery, and I'm in radiology, so she's got a little bit less time than I do. But um, it can happen. So if you guys want to go to a great school, definitely consider UMHS.
Thanks, Zach. And a little less time for sure, as evidenced by the fact that she had to run out of surgery to be able to join us this evening. So thanks so much for doing that, Kurthy. Any last words of wisdom for our audience from you?
Thanks, guys. Well, you guys made it to the end of this talk, so props to you. I hope we were able to answer a lot of questions and kind of give you a taste of what UMHS is like. Um, I think I think something unique about UMHS is the culture, and I think that really stems down from President Ross. He tries to create an organization and a school that's really a family oriented base. Even from the time you start orientation, he comes down, he takes you on a catamaran ride. He really tries to get to know your name. I remember being an EBS 3 student, and here's President Ross, and he said, like, hey to Zach and me, and I was like, how do you know who we are? Like, there's so many students here, but he really tries to take the time to know your name. And that's just kind of the place UMHS is. I know, like, an analogy a lot of people say, especially in my organic chemistry class when I was in my undergrad, was, look at the person beside you, and one person's not going to be in your class. And that's just not the type of environment UMHS is. They really just want everyone to succeed and be the best version of yourself. And at the end of the day, that's just, getting the knowledge you need to know, the skills you need to know to pass our board exams and get to residency. And if you want a school that takes the time to really care about you, then UMHS is for you. But take the time, make sure you do the research, ask all the questions you want to do, because medical school is a commitment. So, we're here to try to make sure that you make the best informed decision for you.
Thanks so much for helping our audience to do that, Kurthy. We appreciate it. And last but not least, President Ross, any last words from you?
Let me see if I'm orange.
Oh, looking good.
Nice color. So, yeah. So, as I said before, I love doing this. I love talking to students. I love sharing with you all the things that we do, our goals, our vision, our accomplishments, the perspective of students, graduates, faculty, learning specialists. I think it, culminates into, what I believe is a school that cares, a school that's dedicated to you, a school that wants you to succeed. Um, I got into this originally because I love students and I want them to succeed. And I believe in goals and dreams and visions. And I want to help students accomplish those dreams and goals. And I do everything in my power to do so. So, once again, what's unique, small, boutique, individual attention, those that really great faculties, the resources that you need to succeed. These are all the things that are really important to get you across the goal line. I mean, there's a lot of medical schools to choose from. We know that we have a proven track record. We're successful. We're going to get you to that point where you're going to graduate, you're going to be successful, you're going to find a residency of your choice, you're going to pass your licensing examination, and we're going to care. We're going to care about you. You're part of our family. You're part of the UMHS family, and that's what I believe in. I mean, I will answer every email that I get from every student at any time of the day, and then sometimes it's 3 and 4 o'clock in the morning. But I will talk to every student that communicates with me, whatever their concern or problem is. I think that epitomizes who we are and what we're all about. And if that's the kind of school you want, that small school environment where people care about you, you're not a number. I think you should really highly consider UMHS. So thank you all. I hope you all have a great night. And it was really nice speaking to all of you. One day I got to figure out how I could actually get people to talk back rather than typing all these things, because I love to hear directly from the students. But anyway, everybody have a great night. Thank you all.
Hey, thanks, President Ross, and thank you for hosting the President's webinar for prospective medical students. And clearly, we've had a well, maybe not clear to you, but it's clear to Sham and I that we have had a very active, very busy session in the Q&A, and we've answered your questions individually. And as you continue to do your research, we know more questions will arise, and please reach out to us in any of the methods that you see in front of you. Certainly the email address that's on there. Our website is umhs.org. You can follow us on Facebook and YouTube and Instagram and what was formerly known as Twitter and TikTok, and we are out there literally everywhere. So we encourage you to follow us. And as you have any questions, please let us know what they are, and we will get right back to you. And so, on behalf of all of my colleagues,
Oh, Sean, one other thing. I'm sorry, I'm going to cut
sure,
you off. So one other thing I forgot to mention, we're working on a couple of articulation agreements in Canada. I don't know how many people are from Canada,
we
but
have a
we're
Guelph student here who I just responded to.
yeah, so we got some people. So we're working with Guelph and we're working with another school, and Kirthy, we'll have to give you an update on that. But hopefully by next summer, we have a summer program for students from Guelph and some of the other Canadian medical schools, where if you want to get a flavor and taste, it's a 4-week program to get a feel for what UMH is all about, what medical school is about, what living in the Caribbean is like. Kirthy is a graduate of Guelph. So I'm hoping that program will get off the ground for the Canadian students, and ultimately we'll offer that to also the students from the United States and Puerto Rico.
Excellent.
Sorry, Sean.
You don't have to be sorry at all. Your name is on the title of the presentation, so you can do what you like. So as you have questions, like I said, follow us on any of the social media that you see there. We're always putting out very interesting content. We're really highlighting, all the great work that our students are doing, Global Health Initiative, everything that's happening at UMHS that is out there. And in addition to that, if you want to review the session that you just viewed, you can head out to YouTube. It will be posted some point during the day tomorrow. It's recorded, and you will be able to view back all of the information that you heard us discussing during the course of the presentation this evening. So those of you who are asking about information coming out for the fee waiver for attending, that will come to you via email. So thank you so much for being here. Thank you for joining us. Thank you for your interest in the university. Thank you for all of the wonderful questions that you submitted to us. I'm not sure if we broke a record, but I think we're pretty close. So Sham and I were very busy answering those questions. So thanks again for joining us this evening, and we look forward to working with you through the application process at UMHS. And once again, for my colleague Sham Daria, Director of Enrollment Management at UMHS, my name is Sean Powers. I'm Vice President for Admissions, and I appreciate you joining us this evening, and I hope you have a great night. Thanks so much.